INICET is just near the corner, so let's see what are the most important topics for INICET exam. And these topics have also great propensity for being repeated in the NEET PG and FMGE exam also. In these important topics, these all are the past 9 years repeated topics of INICET only. From them, I have picked up the most important ones. Before starting, let's decode the INICET exam. So this year INICET, that is INICET May 2024, we can see the subject wise distribution, that is anatomy 13 questions have come, physiology 11, biochemistry 13, pharmacology 14, microbiology 18, pathology 18. Surprisingly, this time community medicine only 2 questions have come. So how much we think this exam is predictable, it also changes and proves us to be false. But from this, we can have a good perspective and we can see major weightage of medicine, surgery and orthopedics with OBGY and pediatrics. So we can have a good understanding that from a pie chart, if I show, if we consider the preclinical subject, it consists of 90 questions approximately in every year. If we consider the major four clinical subjects, that is the medicine, surgery, OBGY and pediatrics, it consists of about 55 questions, and the short subjects consist of only 45 questions approximately. So from this we can understand that which are the most high yielding topics. कौन सा सबसे ज़्यादा हाई यील्ड है, प्री और पैराक्लिनिकल, एंड कौन ज़्यादा इंपॉर्टेंट है क्लिनिकल में से, मेजर 4 क्लिनिकल सब्जेक्ट्स। ओके, बाकी सब शॉर्ट क्लिनिकल सब्जेक्ट्स उतना ज़्यादा इंपॉर्टेंट नहीं होता है। Now the INICET question patterns have changed and some of the new patterns have been incorporated, जैसे कि सीक्वेंस वाला क्वेश्चंस बहुत ही पूछता है, कैरियोटाइपिंग का सीक्वेंस हो सकता है, मसल कॉन्ट्रैक्शन का सीक्वेंस, ये सब प्रीवियसली आस्क्ड क्वेश्चंस है। तो इसके बाद भी कोई भी चीज़ का अगर कोई सीक्वेंस है, then that has a very high propensity of being asked in the question. Reasoning assertion, though in the recent years it has reduced a bit, but there is a good chance that reasoning and assertion questions are being asked again. And how many statements are correct, and this is very much confusing because you know among the 4 options that 1 or 4 statement are correct, but in the option they would give 1 4 correct and 1 2 4 correct, and you don't have any idea about the option number 2. So that time it really becomes difficult to mark the questions. So you need to practice this pattern of questions also. In anatomy, if we see, I am just telling the important topics only. So base of the skull is very important, and mainly the foramina. The brain sections are very much important. After that is the branchial arches is very much important. In thorax, the diaphragm openings are important. We have a memorizing trick also, like I8 10x at 12. In upper limb, the nerve functions and the injuries is very much important. The intrinsic muscles of the hand is very much important. The attachment near the femur and the nerve supply of the muscle of the gluteal region is very much important. Coming to physiology, the most important topics, you can see the list among them. uh, Now a question would arise that what all I have highlighted. So why I have highlighted some things, because they have been asked multiple times. In case they are asked in more than equal to 4 exams of INICET, then I have highlighted them with a highlighter. Okay, so titannizing frequency has been asked more than equal to 4 number of times. So titannizing frequency is 1 by contraction time, and this has been asked in multiple number of times. Cell organelles have been asked. The FRC and the minimum volume graph has been asked many times. The sleep cycle consisting of the NREM, REM and the awake state, The EEG, EOG, and EMG graphs are given, and from that you have to identify whether the person is in REM sleep, NREM sleep, or in an awake state. Most of the cases, the answer is REM only. In case of renal, GIT, and endocrine, we see that factors influencing the GFR has been asked multiple number of times, and this year also it has been asked in 2024. Clearance formula, many times it has been asked. GIT hormones, signal transduction, and as I said that you have to practice this new pattern PYQs of the INICET exam. So you can practice the exams with the time-based sessions in Reflex app itself, and the cost is very much minimal, that is 599 only. Why I am saying this? Because I am working in this app and modifying the explanation sections as a content reviewer. So कुछ कुछ मेमोराइजिंग टिप्स एंड ट्रिक्स ऐड किया हुआ है जो तुम लोगों को याद रखने में बहुत ही हेल्प करेगा. In biochemistry, the hyperlipoproteinemia this year also was asked. Glycogen storage disorder this year was asked. Pyruvate dehydrogenase complex many times, and the integrated concept is that why acetyl CoA cannot form glucose, or why acetyl CoA is not glucogenous, just because the pyruvate dehydrogenase step is unidirectional. The enzymes involved in gluconeogenesis was asked multiple number of times. PCR, the types of PCR, and what all advantages the real-time PCR and the reverse transcriptase PCR has. These are asked multiple number of times, and genetics is a hotspot for INICET. Vitamins are asked nowadays more and more. In pathology, the stains are very much important. Coagulation pathway, APTT, PT, aneuploidy like the Klinefelter syndrome, the Turner syndrome, concept regarding the pediatrics are also asked in case of Turner and Klinefelter syndrome. The inheritance pattern and the pedigree analysis. In trinucleotide repeats, mainly the Huntington is asked, Huntington's disease. In case of hypersensitivity reaction, uh, Arthur's reaction is which type of hypersensitivity, or graft rejection is which type of hypersensitivity. IHC markers are more and more asked, because in case of a tumor you have to know the IHC markers. In case of any controversy or you cannot make the diagnosis, only the IHC markers can guide you to the diagnosis. Langerhans cell histiocytosis. In hematology, more and more repeated topics you can see, like the Hodgkin lymphoma, n number of times it was asked, n number of times. Just sickle cell anemia, iron metabolism, iron profile, blood storage, multiple times यार, बहुत ज़्यादा. Blood storage, how you store blood, how you store PRBC, how you store platelets, how you store cryoprecipitate. Then blood transfusion and blood transfusion related reactions also. In case of massive blood transfusion, what all reactions occur, what all electrolyte imbalances occurs, these are asked very much frequently. The vials are very much important. The constituent of vial and which color vial is used for measuring what. Like the gray vial has sodium fluoride and it inhibits glycolysis, so is used in glucose estimation. Among systemic lung cancer are multiple times asked. Colorectal polyps are asked. The schwannoma histopathology has been asked 4 times. Okay, so from this you can understand that INICET focuses on particular topics and it repeats around them, because more than number of 4 times you can see so many topics are being repeated. In pharmacology, the clinical trials are asked. Drugs used in pregnancy, adrenaline dosage is asked many times. Monoclonal antibodies notes I have given in my Telegram channel. Here also I am giving in the description box below. If you want, you can go for it. In antimicrobials, the common pathogens and the drug of choice, mainly the uh, resistant strains, which are the drug of choice for the resistant strains. the antitubercular drugs, the ERT mechanism of action and the side effects, the antifungal drugs mechanism of action. This year, voriconazole was also asked. Praziquantel is asked multiple number of times. SGLT2 inhibitors multiple times. This year also two questions. Linagliptin, L for L, so it is excreted by liver, therefore is used in renal failure. CNS lithium is a favorite. Up to 2022 it was asked 5 to 6 times. In 23 and 24 it is not asked till now, but in 24 in the November it could be asked. SSRI side effects multiple times asked. Anti-cancer drugs, antiplatelet drugs, antiemetics. In microbiology, the staining, microscopy, pseudomembranous enterocolitis multiple number of times. Strains of E. coli, EHEC, EHPC, EPEC, EIEC. In the fungus, you can see the maximum number of topics repeated, and it is very much high yield. Limited number of topics like the chromoblastomycosis, porotrichosis, beta D glucan test, rhizopus, it is obtuse angle branching, and aspergillus is acute angle septate branching. This in microscopy is being shown, and you have to identify. In my year INICET, two questions came from rhizopus one and one from aspergillus. Coccidian parasites you can memorize according to the sizes. Malaria, the Plasmodium falciparum gametocytes is shown many number of times. Parvovirus B19, what I have to say, this year also one parvovirus B19 was asked. Okay, hepatitis viruses and the antibody curves of the hepatitis B, you have to remember. In trauma injuries images you have to see. Drowning is asked multiple number of times. Marbling, the timing when the marbling occurs. Criminal responsibility of insane, now you have to see the BNS also instead of IPC. Health related declarations you have to see. Poisons are important. In PSM mainly the biostats is very important. You have to review the biostats very well. This time two questions were asked, but next time in the November 20 questions could be asked. Dog bite management, very much important. Vectors you have to remember thoroughly. In ENT, auditory pathway is a hot favorite for the examiners. In a nasal septum, blood supply is also a hot favorite. Corneal ulcers has been asked multiple number of times. Optic neuritis, third nerve palsy. This year also third nerve palsy was asked. In CVS atrial fibrillation, this year also asked. So you can see that many topics are being repeated, and this year about 120 were PYTs only. The PSVT is important. Acid base balance, tension pneumothorax, very important both for INICET and NEET PG. The hypercalcemia management you have to know. Seizures management, stroke management, dengue is very much important. In neonatology milestones, neonatal resuscitation is very much important. Respiratory distress syndrome and its prevention, that is the dexamethasone and the betamethasone dosage is very much important. Diarrhea management, in general surgery, IV cannula, sutures, suture materials, shock, scoring, nasogastric tube insertion, Glasgow coma scale, very important. In GIT, the perforation management, the gastric perforation management is asked n number of times. The appendix and appendicitis has been asked many times. Colorectal cancer, bile duct injury, acute pancreatitis. This year also TNM staging of breast cancer was asked. Breast conservation surgery is very much important. In miscellaneous you can see the psoas abscess has been asked many number of times. I've said aneuploidy, and so the aneuploidy screening is also very much important for the ops perspective. The physiological changes in pregnancy, PIH, this year also was asked. So in important topics you can see that many questions are being repeated also. The drugs used in postpartum hemorrhage, this year also it was asked. And what are the contraindications of the drugs used in PPH? Okay, कौन से drugs used होता है and कौन सा contraindicated है in certain conditions, which is contraindicated in asthma, which is contraindicated in peripheral vascular disorder, which is contraindicated in case of heart disease. You have to remember modified Bishop score in gynecology, pap smear, ovarian cancer, the types and the tumor markers are asked repeated number of times. The vulval cancer, endometriosis, seminal analysis, amenorrhea. This year also one question was asked. Amenorrhea whole topic is important. Trichomonas vaginalis, Mullerian malformations. This year also question was asked. PCOS management is asked many times. In psychiatry, the OCD one question was asked. Alcohol withdrawal syndromes, Korsakoff psychosis was also asked this year. Like Wernicke's syndrome is Goa. So global confusion, ophthalmoplegia and ataxia. And case of Korsakoff psychosis is confabulations would be there and there would be amnesia component. Anesthesia, all the capnographic curves, the CPR, what is high quality CPR was asked in this year also. Oxygen delivery devices, orthopedics, the anterior and posterior dislocation of hip, the giant cell tumor, one topic, only one tumor, six questions were asked. Till now, in the six exams, questions were asked. In case of trauma, the types of fracture and the types of fracture healing are asked. Fat embolism, patellar fracture this year also was asked. The ankylosing spondylitis this year also it was asked. Rickets this year also was asked. Osteoporosis is asked, and the management of osteoporosis is also very much important. The radiology, I have named the topics like nephrocalcinosis, image, pneumonia. All this you have to see the images only, except that of the acute radiation syndrome you can understand. Okay, arachnoiditis, you have to see the images. In radiology, what all topics I have mentioned, you have to search the images, or if you have them in your notes, most probably you would have them in your notes, so just open the notes and see them. Okay, in case of dermatology, the last subject now we have came, the acne management is very much important, and mainly the contraindications of isotretinoin or the teratogenicity which it can cause. All the teratogenic drugs are important for the INICET exam. The Pemphigus vulgaris and foliaceous fishnet appearance. This question, this fishnet appearance was asked three times in the INICET. Bullous pemphigoid, it causes itching and tense blisters. This term was asked four times and the diagnosis was asked. Herpes zoster, many times it is asked. HPV, all the strains and what all diseases it causes, what it causes, each strain you have to remember. Okay, leprosy though very important. This is endemic in India, and that's why it is more important for the INICET. Previously, a difficult question regarding the chemoprophylaxis of leprosy was asked. This year also leprosy question was asked, that clofazimine causes which side effect, that is it causes pigmentation and it can also cause ichthyosis, clofazimine. So all the anti-leprosy drugs, you have to know the common side effects also, like the rifampicin can cause uh, orangish discoloration of the urine. Psoriasis management is asked many number of times. The pitting of nails, the scaling, these all are asked, and the management is asked many number of times. Allergic contact dermatitis, mainly the patch testing is asked, and this year also one question regarding the patch testing was asked. Herpes zoster is important. This year herpes simplex was asked. One question, genital herpes is caused by herpes simplex virus 2. So all the genetic ulcers are also very much important. This is also very important topics. STI kits are also important. I think this summarizes all the important topics and how you can get this list. The link is given in the description box below, and it took me about 1 week to make this list, but I am giving it only for rupees 29. That is my all India rank also, and I am giving this notes at rupees 29. So if you wish, you can go and have it now. And इनमें से कितना questions you could expect in your exam in your INICET exam, be it the November INI or be it the next May INI, approximately I can say at least from this topics 120 questions at least. ओके सो लास्ट 10 डेज में क्या करना पड़ेगा, ये वाला सारा टॉपिक्स देख लेना, ये सारा टॉपिक्स ही अपने नोट से पढ़ के जाना, ठीक है। लास्ट 10 डेज में यू शुड नॉट be too much hectic and you should be heiled also, so that all the common topics you can see and just vomit in the exam. So 120 क्वेश्चन अगर वहाँ से आ जाएंगे लास्ट 10 डेज जो पढ़ रहे हो ठीक से, तो तुमका ऑटोमेटिकली एक को बहुत बड़ा रैंक बूस्टर मिल जाएगा and you can get a good rank in INICET. I think like this kind of note you won't get anywhere. So go have it now. And now two more videos are popping up. If you have time, go watch them now. Okay. So do consider subscribing to my channel if you like the content. So stay safe and all the best for your exams.